Okay, so now I'm in conversation with Chris Barker, who is CEO and founder of Spirit Healthcare, who are based in Leicester. Yes, I want to begin by, how long have you been involved in technology for healthcare?
So we launched our first digital health product believe it or not, in 2010 as part of Spirit Healthcare, which is now part of the Spirit Health Group. And it was a product that we worked on in the States, in the US, and then brought to the UK with good old-fashioned big computers that we put onto people's desks. The technology has recently advanced quite a lot, David.
Absolutely, and you've been pretty much at the forefront of technologies which I think now are extremely important in the advent of coronavirus. So maybe it'd be a good time for me to just load up your slide presentation and we can walk through it together, and we can pause on various highlights of that. So I'll go into screen sharing mode. So you should now be able to see your presentation on screen. Okay.
Yep.
So your slide presentation is titled Virtual Community Wards, and it's about a product that you've got called Clinitouch Vie. So I'll just go through the slides, and so just tell me a little bit about the background to these health-related challenges.
So Clinitouch was, as I said, conceived back in 2010 and has been used in the NHS across that time. It's also a published evidence base of how it works. If I look at the challenges that it tried to overcome in normal times prior to COVID-19, then essentially we had a growing demand for services. So we needed to find ways to stretch our existing healthcare resources further. We also had increase in hospital demands, which we wanted to reduce. And if you look at most healthcare services and how they work, they tend to be quite reactive, i.e. someone gets poorly and something is done unto them. So what we wanted to do was find a way to be more proactive in that healthcare arena and try and find ways to be presenting patients who were not yet poorly.
Okay, so Clinitouch is designed to address those by connecting patients in their home or care settings with clinicians and help to address some of the problems that you've identified. So this is the screen that people will see on their Clinitouch platform. So this is presumably a kind of iPad application.
So Clinitouch is a bit of software that can be downloaded onto any device that someone has, David. So you can use it on your own phone or a tablet. If people don't have access to that technology, and at the moment with COVID, we're deploying hundreds and hundreds and hundreds of tablets into the NHS to help support people who are self-isolating. And then this is the home screen that someone would see.
Yeah. Okay. So it performs a variety of tasks. So we're talking about here a concept of a virtual ward, which is recording patients' vital signs, and it's using artificial intelligence and algorithms to be able to assess risk. Is that correct?
Yes, that's correct. So in effect, a patient can create some data from questions, from vital signs that gets sent into a database that risk scores that using algorithms, and then clinicians are pushed that data in real time, so they can prioritize on an ongoing basis the caseloads that they're managing, so that they can focus on the most needy at any given moment in time.
Yeah. So looking at the infrastructure behind Clinitouch, you've got a patient app, and I understand that you get various devices that will connect to that. What kind of devices are you currently connecting to Clinitouch?
So there is quite a long list. So everything from blood pressure machines, blood oxygen saturation monitors, scales, atrial fibrillation devices, respiratory rate monitors. I can't say sphygmomanometers monitors very well, but there we go. The list of devices that we can put in there is pretty much unlimited, David. As long as there is a Bluetooth connection, we can Bluetooth into the system.
Okay, and so some of these devices, like wearable devices, will be consumer type devices. Presumably others will be medical grade devices.
Yeah, correct. So, in this current climate, getting access to devices is hard. So, if people have their own devices, then we have also made it possible for people to use their own devices to input data into the system with COVID-19.
Okay, so it's a little bit along the lines of personalised medicine, really. As you're saying, it's you're able to configure it to individual patients' needs.
Yeah, so the system is typically deployed by NHS clinicians, and it's typically deployed into cohorts of individuals. So if I look at a current deployment we're working on at the moment, it's largely focusing on people with respiratory disease and heart failure. And in that, you can then tailor the questions, that people only get asked questions and present data that's relevant to them and their condition at any given time.
Okay, so in essence, it's really reducing the load on hospitals by enabling safe remote care. Is that in a nutshell?
So yes, I think there's one other thing as well, which is that it supports self-isolation. So this is about people who are at risk, who are really some of the most vulnerable in society, be they on a case management list from a long-term conditions nurse, or be they sat in a care home or a nursing home. We can remotely monitor them, we can keep them safe, and we can have clinicians interacting without any physical contact.
Yeah, I guess this is very important in today's climate with COVID-19. And some of the research results seem to be quite impressive, particularly with the savings in hospital admissions, but clinical outcomes also very important.
Yeah, so we can demonstrate with published results that we've got a reduction of 67%, so 2/3 in unplanned emergency admissions to hospital in COPD, so respiratory disease. We can also show that we do that whilst increasing the productivity, so the number of patients that each chronic conditions nurse can manage, whilst improving patient outcomes. So literally across the board, it meets the demand.
It sounds like a no-brainer, really, but at the end of the day, I guess the bottom line is the patient experience and the fact that you're able to save lives.
Yeah, I mean, so this is a piece of technology which is actually, it's been developed so it's simple, so that patients and individuals and people and our relatives can use it, and it's there to support them and keep them safe and well at this time.
So it's pretty much a win-win relationship between the medical profession and the patient cohorts. And prior to COVID-19, you seem to have specialised particularly on chronic health conditions, which normally would be at risk for hospital admissions. Is that right? Yeah.
Correct.
Okay, so here are the details shown on the screen there for anybody who wants to follow up with you. So we're going to go back into the conversation now, is there anything else you want to add before we get to the main event on Wednesday, Chris?
So from my perspective, just to say that I think that the digital now has reached its time in healthcare, and I think that there is now an opportunity to really help deliver some amazing patient benefit whilst helping our stretched health services to cope with this COVID-19 crisis. And some technology like Clinitouch can help both in terms of existing long-term conditions patients, in assisted discharge from hospital of patients either with COVID-19 or in other scenarios, and also protecting people who are in care homes and nursing homes at this time. So I think it is a chance to change the NHS and probably leave a legacy even after this terrible pandemic.
Yeah, I think I would endorse exactly what you're saying. COVID-19 is a terrible situation, and we really don't know what the outcome of it is going to be. But it's hope that we will find ways of using technology like yours and like the technologies that are being used by others in the medical profession to change practices in the long term, so that if something ever like this happens again, we can manage the situation a lot better. So thanks very much for your time, Chris.
Thank you, David.